This is Dr. Amanda from StraightSmile Solutions. Today we're going to be talking a little bit about clear aligners. Specifically, we're going to talk about single arch versus dual arch clear aligner treatment and why I always recommend dual arch clear aligner treatment. And I know that this is a hard concept for some of these patients to understand. They might look at their top teeth, maybe they've had treatment before and they see some lower relapse and they're like, I don't need top aligners or top treatment, I just want lower. And I get that all the time. But this is my basic scripting for the why not behind that. So, first of all, if the patient has crowding, in order to eliminate the crowding, there's three different ways we're going to do it, right? Number one, we're going to go ahead and procline the teeth forward, tip them forward. Number two, we're going to widen the arches. Or number three, we're going to do interproximal reduction, which is filing in between the teeth, right? Now, as we expand or contract the arch forms, it's going to get wider or narrower. And it's really hard to do that, to resolve an issue, when you don't have the opposing one to work with it, right? Because you're going to need to expand them both out. Because if you just do the lower, then the bite's not going to fit together anymore. And if you don't notice that the direct to consumer companies out there, they generally don't do single arch because they've learned that it doesn't work. So if they're not doing it, you shouldn't be doing it either. So I recommend that all patients should be dual arch. Now, if a patient really is obstinate and does not want dual arch treatment, I have some, stock waivers that you can have them sign saying that it's a release, that they understand the risks, that they understand their bite may not fit together. It's a little bit risky on your part because not unlike some of the other companies that are out there, if you know this is not the right thing for your patient, but yet you're allowing it to proceed, if there is a bite problem or a TMD issue later because you allowed this to proceed, who is responsible, right? So, some people think they're protected if they have a waiver signed. It's a little bit of a gray area, so think about it carefully. Number two, another way that you can deal with it is you can say, sure, we can proceed, but if there is a problem, we're going to need to convert to dual arch for an additional fee of X. That usually kind of solves the problem, and usually I'll make the additional fee of X be more than it would be if they proceeded to dual arch at the beginning. So I usually don't give any discount for single arch treatment, same price. So if you really only want it, that's fine. But if you decide later to convert to dual, there will be an additional fee because it's going to take me more time and it's going to take more office visits and the total treatment is going to take longer, than if we just did it all right at the beginning. So that would be my suggestion. Again, like always, if you want any of these stock forms that I have, all you need to do is send me an email, info@straightsmilesolutions.com, or visit straightsmilesolutions.com and send us a message. As long as you let me know that you're a doctor, we verify that you are indeed a doctor, a licensed doctor, I'll be glad to send it to you. So it's just one of the things that we do for free for any dentist in the world. Give us a buzz. All right. Thanks so much. And keep those questions coming. This is a great question. All right. Thanks so much. Have a good one.